Well, let's just take stock. We talked a little bit about the issue of growing up, and then we focused a lot on growing up with illness, and then making hospitals more child and youth friendly. It's been a bit of a pitch in that direction. Now I just want to think a little more broadly about what we've experienced with Orch and what has been on the radar in recent times. But one of the most important things that I think has happened in this advocacy space is the development of a set of standards for the care of children and young people in healthcare services. Some of these things are enshrined in law in places like United Kingdom, New Zealand and Canada, but at the moment we just have a set of standards which we hope that health systems aspire to. It's not part of accreditation. We feel very strongly that it should be, so there's more to do in capturing the hearts and minds of health systems around standards for children. Just to give you an example, in this particular joint report with Children's Hospitals Australasia, Orch, and what was the other one? Australasian College of Physicians. Oh, kill me. They actually led this initiative. These are some of the examples that ideally adolescents should only be admitted to a designated adolescent area. It's not possible, of course, but this is the statement of the ideal, and have programs supporting that. Young people should be consulted, involved in decision making, and have their views and preferences considered. So obvious, we believe in it passionately. It doesn't always happen, and that's the basis for sometimes complaints. The role of advocacy, and I think this is really where Orch can be proud of its achievements over such a long period of time. These psychosocial reports have been the only source of data around how hospitals dealing with children manage. And we have discovered through these two surveys so far that there's a lot that's missing from the system in terms of play areas, friendly environments for children, and also an unfortunate discovery that a lot of the staff that are working in designated children's areas where they exist haven't had what would be considered adequate or optimal training. So once again, they're sort of triggers for concern and action. Orch's achievements can be summarised in this slide. Before 1973, it was not allowed for parents to be with their children in hospital. Orch changed that, and forevermore parents are going to be grateful for the opportunity to be part of and involved in going on. Child-friendly environments, play areas, the importance of good training, standards of care, and the Orch Grandparent Scheme, which I think really needs to be highlighted in this talk, and we will be finding ways to celebrate the 20th anniversary of the Ward Grandparent Scheme. A recent survey of ward grandparents and parents and social workers involved in their care. Anne will correct me if I'm wrong, but 17 hospitals?
12.
12, okay.
New South Wales.
It's 17 soon. 12 hospitals in New South Wales with this program. Mostly people in their 50s and 60s, mostly women, giving their time as volunteers to mind children in hospital, particularly when they're long-term, giving parents respite. The survey showed that parents think it's a lifeline. They're so grateful for it. Sometimes the issues of mentoring and supporting the ward grandparents falls to social workers, and it's done in a voluntary manner on top of their ordinary work, their everyday work, I should say. And that's an issue we'd like to address. We're entering into a series of conversations with a very respected non-government organisation that may provide some support, because we think not only in terms of in-kind support of people stepping up and offering the services, it really would be wonderful if Orch could find a way to better coordinate and support the ward grandparents. There was also a survey of what parents would like to see in emergency rooms. These are the faces of hospitals, and they're often scary places, distressing places. No child wants to be privy to adults who are vomiting or bleeding or behaving aggressively, whatever. So that's another challenge really to the system coming from Orch and its supporters. Think very carefully about what's happening in emergency rooms around the country. And we're not alone. There are organisations like Orch, even some that preceded its establishment in 1972. And it's very interesting to benchmark against their activities and to think about the importance of advocacy, and particularly where there's a consumer voice, as there is with Orch. So I'm going to draw to a close and then have a bit of a look at some of the questions. I wanted to finish on a positive note, and I hope this idea of being optimistic and hopeful about what we can do and to be empowered as adults who care about what's happening with children in healthcare to do something about it. But this is a very nice quote. It comes actually from a mental health practitioner. Health is always present regardless of the presence of disease, as the skies are present in spite of clouds on the horizon. So there's always something that can be done that is going to be helpful. When I started, I mentioned that I worked in hospital environments and always have since I completed my training as a physician and then an adolescent physician. And I've recently revisited the Serenity Prayer, which says, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. I think those of us working in healthcare need to be aware that we can't always do the things we know should happen, for whatever reason, lack of resource, policy. But there are things we can change, and there are things we should join together and be very vocal about wanting to change. So that's more or less my parting shot. Everything these days is .com this and .com that. I just can't stand it anymore on our website that can help you. And I'll leave this on the screen for a moment. But the Centre for the Advancement of Adolescent Health website is still very alive and active, even though the team has transferred into the authority called Kids and Families. There's a lot of important information and linkages and resources which are very accessible there, all downloadable for free.
One more thing, David, can I just alert people to the resources pack, that there's a range of documents that are available